Assalamu alaikum, good evening and welcome to a very special episode of Health is Wealth. I am your host, Shabnam Riaz. Well, you know, today we're delighted to be here and to have a special program in which we are going to highlight the Pink Ribbon Awareness Campaign. What is this? It's an internationally designated month of October as Breast Cancer Awareness. This is what's happening in this month. This is why you've probably seen, you know, pink ribbons as the ones that I'm wearing and my guests are wearing here today. And what this actually signifies and symbolizes is drawing awareness to breast cancer. So many things that can be done to, you know, have early detection of the disease and to generally create awareness amongst the public. So in today's program, I'm very happy to have my guests here, experts. Dr. Rakshanda Rashid is here today, who's a general surgeon, special interest in breast diseases. You've recently retired from PIMS as a professor of surgery. Thank you very much for being here with us.
And thank you for having me over here.
It's a delight. We discussed this issue before, but because this is the specific month, this is why we're going to talk about it again and see what else information we can give to our viewers. So thank you for taking out the time to be here today. And we also have Dr. Uzma Shahid, who's a medical specialist. Thank you very much, Dr. Uzma, for being with us here today. And we're going to talk about, you know, what this month signifies and what exactly is the Pink Ribbon Campaign.
Thank you, Shabnam.
Okay, so I'll start with you, Dr. Uzma. You know, tell us about this Pink Ribbon Awareness Campaign. What's it all about?
Actually, Pink Ribbon is basically an international, it's a symbol. And back in, say, 1990s, there was a woman, Susan Komen, and she started it like she wanted to do something for the awareness, and they did a walk in New York for fundraising.
Okay.
And there she spread the pink ribbon to everybody during that campaign. And then, you know, it started and it became popular, and Pink Ribbon started. It's like, it's an awareness program. Awareness is given because breast cancer is one of the most leading cause of death among the women. And that's why it we have to, you know, and the more earlier it is detected and the more awareness we have, it is, you know, almost curable like that.
Absolutely, absolutely. Dr. Rakshanda, as you know, we're saying that awareness and the early detection is key. That is something that doctors and, you know, surgeons as yourself keep telling us, that it's the awareness, it's the screening, it's the mindset to be aware. How much have you seen a difference in patients who are coming to you now for taking advantage of this campaign and being more aware to the changes going on inside their body?
I think the credit goes to the media. It has done quite a good job because we are getting quite a good number of patients according to the studies in Pakistani studies in medical literature, about maximum patients who come from rural areas are in late stages. But the patients who are coming from these urban areas or from the cities, they're very well aware of the disease. And even if there's a little bit of pain, which is a natural pain for a woman, they do rush to us for the examinations, and they're very concerned. And I have noticed that even those ladies who are less privileged, even they have little bit of awareness about the thing, and it is, I don't know how to share it. It's the male portion who says there's nothing wrong with you, you don't need to see a doctor, you will get cured of this, and they take them to the places for dam and the root, all that. So awareness, but still, as they're coming in later stages, we need to spread awareness, and we need to have screening centers. And I think through this forum, we can spread or we can get through to the government that we should have more screening centers. If we have screening centers, they would come to the centers for their checkups.
Yes.
And I think screening centers and awareness both go hand in hand.
Absolutely true. Dr. Spencer, you know, as Dr. Kshinda has said, it's mainly the the ladies from the urban areas who are coming forward. And so how to get this projection through more to the, you know, the less aware public?
Interestingly, it is a disease of, you know, the more privileged ones. It is a disease.
Really?
Yeah, yes.
Really?
Yes. The studies say this.
How is this is
Because, you know, it is a disease of affluent societies, you know. But the thing is, obviously, being in Pakistan, 90,000 reported cases every year, and 40,000 die every year. So, you know, awareness is so important. Media is the most important thing, you know. And now I see pink ribbon things on newspapers as well, and that's very good, you know. Kids know about this. Why not colleges? Why not schools, you know? So that the girls know about it. We can do that. And even in government schools, because they are widespread in the whole country.
right?
So if there's awareness among the new generation, they'll know it, and early detection can be done. So that's the most important thing, awareness.
Right, exactly. Dr. Kshinda, you know, I wanted to ask you this question as well. It's often come to my mind. We usually, when we talk about the screening process, usually we hear a lot of emphasis on a lump in the breast. And, you know, mainly girls are told, or women are told to have those self-exams, and then if they detect a lump, to go to see a doctor immediately. How about those situations where a lump cannot be felt, but something comes up in, say, a mammogram or an ultrasound? What is that?
First of all, I would like to say all the girls who turn 20 should start examining their breast every month when they finish with their periods, and so that they become familiar with the texture of the breast, and whenever they find something new, they must come to the surgeon for the further investigations. And then the question you asked, yes, there are some lumps which are not palpable or which are not felt by the hand, by the physician as well as by the patient herself. So what to do now? So it is for those lumps that we advocate screening. Screening of the breast is required, especially for those lumps who are not palpable, and there are specialized techniques to detect those lumps and then to deal with those lumps. And the lumps which are in stage 1, they have disease-free survival. There is no disease in those 5 years, is 100% in very early stages. But if they go to the second stage where the disease travels to their underarms, then it falls to 90%. So basically this is a chronic disease. It has been declared as a chronic disease. So patients should not be scared of breast cancer anymore. They should come forward and they should have themselves screened or they should have themselves examined, because this is a chronic disease. It can be controlled now. Though we cannot cure it, but we can control it. It's just like diabetes, it's just like hypertension, it's just like heart disease. You need more follow-ups and you need more treatments, and that is all.
How much would you say that our social mindset makes a difference in women coming forward or speaking to other family members about this?
See, number one, breast is a private area. So people don't like to talk about breast. So when I used to be called on this media in my early years, I was a bit shy myself. How would I say breast in front of the public? Now, I think we should get over with these things.
Exactly.
This is a disease, and this is so very common in this part of the world. and we should talk about it. Yes, the ladies, they don't, the women who have breast cancers, if they have grown up girls and we tell them you examine your breast every month, you know what do they tell us? They say no, by touching the breast we'll get breast cancer. We have to tell them these
So
are
many
not
myths.
landmines. You have to examine your breast to come early, to have a smaller treatment, and there will be no change in form and figure.
Exactly.
You will continue as such.
That's so true, to be proactive and to get that message across. Dr. Isma, tell us about the links that we hear about with breast cancer and diet.
Okay, with diet, mostly the fatty food, they are thought to be responsible because they can convert into carcinogenic agents, and so more heavier and fatty foods.
So that's, I don't know if that's really common knowledge for many people. I mean, that's the first time I've heard about it. So I don't know about how many people who actually know that there is a link between fatty foods and the risk of getting breast cancer.
And the other thing is, the more people who do more exercises, they have less chances of getting breast cancer.
Okay.
So that's a protective thing. It is a very common thing and known. It's a known thing that it runs in families and it's inherited. But mostly 95% of people who are diagnosed don't have any family member who has it.
I see.
So if they have like more physical activity, less fatty food, that's a sort of a protective thing.
Okay.
That can be helped. And beverages and these things also can be, they have the carcinogenic chemicals in them, so they should be avoided.
Right. So there is a link there that a person can adhere to give them more levels of protection, because that's basically what we're talking about. If a person is high risk, what should be the steps, what should be the procedure, how they should take things forward. And if you're not at risk, but the things that you may be doing that might put you at risk. Okay, Dr. Chandra, tell us about, what exactly is a cyst in the breast, and is that different to a lump, and is it harmful? What exactly is it?
Yes. When we say cyst, people get very worried. Probably they are having breast cancer. But as I deal with breast diseases as a whole, 90% of the load is lumps which are not due to cancer, and 10% lumps are due to cancer. And these out of these 90%, one of those is cyst. Cyst is small, which is felt as a lump. But it is a small, you can say a sac which is filled with fluid. Cysts are usually they are not cancerous. Usually, especially if the ultrasonography says they are simple cysts, then they are not cancerous cysts.
Right.
And it's the solid lump. See the difference between a grape and a cherry. Cherry is solid inside, so it is a solid lump.
Okay.
And this
Grape
is it is filled with a fluid. So this is the difference between the two.
Right. So what causes a cyst to form? Is it natural phenomena?
Yes, it is natural. Cyst occurs in early ages when breast is forming, and cyst then, on the other hand, occurs in the late ages when the breast, when the milk producing system is again is not available, or it's also how shall I say that the woman is no more capable of feeding. So when she's developing breast and when she's getting her system, I should say they are around menopause. These are the two stages when they have at the maximum. But in the middle, usually in the middle age, or everything which is given in the books is happening in our patients 10 years ahead. If they are having, if we have studies from Europe and American studies, and Scandinavian studies, they say it's happening around 45, it will happen in 35. If they say breast cancer is around 35, we see in 20s.
Is that just in Pakistan or world over?
It's just in Pakistan, and it has been said it is because high level of fats intake. Fat intake is so much in the country, and such a bad quality of oil and ghee and blah blah, and they fry things and they barbecue. They don't have, you know, they don't have things to eat, but they have oil to fry their food.
That's
They
so
will
true.
they will eat dal fried, everything
Yeah,
fried.
that's
Why
right.
are you frying these things? And if we compare our studies with Indian studies, they don't have that much risk. The amount of cancer we are having here, oh, it's like a rampant disease over here.
It's highest in the Asia.
Yes.
You know, these are, you know, it's so important to do programs like this, I would say, because this is something that I'm learning.
Yes.
I really did not know about this. This is so important because, you know, look what is being said. Fat, a direct link, and having Pakistan having 10 years that disease coming earlier than the rest of the world. I mean, that is something to really sit up and take notice. I don't, you know, understand as to why we would be on a path to self-destruction, but it seems that we are. These things are really, really important. Okay, so the message here is, you know, amongst all the other things that we're talking about, screening and everything, diet and what you're eating, what you're preparing for yourself, what you're preparing for your loved ones is very, very important. And not just breast cancer. Also, when we talk about heart disease and other problems as well, you know, we're told again and again to be very, very, you know, to keep the quantity of oil as in limits, which is very important as well. Okay, Dr. Uzma, for the ladies watching the show, or for, you know, people in general who don't know about what menopause is, premenopause and menopause, the ages, the, you know, how one tells if it, and the all the things associated with us.
Yes, it is very important because regarding even today's topic, this is one, if you have late menopause, there are more chances of getting it, or you have an early, if the period starts, you know, the cycle starts early, then you have more chances. So it's, you know, a natural cycle that happens, you know, it starts and begins in teenage, when a girl is around, it's like 10, 11 years old, they start to have cycles, and they end usually between 45 to 52 years of age, usually 51, 52, but it's happening earlier over here.
Again, another, is that something, why, is that just for Pakistan, or is it?
No, it's like worldwide.
World over, okay.
Yes, but here it is like that. The other thing is there are protective, when we are having cycles and when a woman is in reproductive age, there are protective hormones, especially estrogen. They help protect you with lots of things, but once they are gone, so then you start developing things, even osteoporosis and everything.
Exactly, and heart puts it at risk for heart attack as well.
Yes, because those hormones are actually protective during that time, and when they are finished, so you are exposed more to these things. So the thing is, hormones are very important when women are taking during reproductive life. They are taking oral contraceptive pills, you know, combined pills, and we have so rather than combine, it's better that they should have estrogen containing pills are more protective and important. So menopause is a natural thing. If physically and if the diet is good throughout your life, I think they will have it at their proper times, and they won't be having so much problems. It has a definite risk factor with breast cancer.
Right, right. Okay, Dr. Akshinda, you know, we were talking about the difference between a cyst and a lump and the various other, you know, things as well. A patient comes to you, they have something that's suspicious, they have further investigations. How do you decide if a biopsy is required at that time, or just to monitor? What makes you decide in that?
If a patient comes with breast lump, or if any, for that matter, any patient whosoever presents to us, we always send them, if they are under 40 years of age, we send them for ultrasonography. And if they are above 40 years of age, I do a bit differently. I always send them ultrasonography as well as mammography. Why ultrasonography? Because many of the patients have hidden benign diseases as well. So if I want to clear them, I want to clear them from both.
Right.
Because people don't come here regularly for checkups.
Right.
And this is for a patient who comes with any complaint. Now, if a patient comes with complaints and there is a lump, every single lump has to undergo triple assessment.
Okay.
It has to have 3 assessments. And here I would like to take a liberty for the awareness of my public. Public, because awareness programs are for public, not for patients. They are already suffering. So whenever they have lump, they have to come, usually they like to go to a gynecologist, and we need to tell them they have to go to a surgeon's. And now we have many female surgeons in bigger cities, and so these ladies should not have any problem. So when they come with lump, they need clinical breast examination, that is by a physician. Then we send them for ultrasonography and mammography, and if we find a lump on these 2, and if the lump is, we can feel the lump or the lump is palpable, we always send them for true cut biopsy. We take out small cores. But these days it is mandatory to have true cut biopsy under ultrasound guidance, because if the needle hits a normal area, it doesn't take out the tissue from the tumor itself, then it's so difficult to convince a patient to go again and have it done again.
Right.
So internationally, whenever there is a lump, it should undergo ultrasound guided biopsies.
Okay.
And if the biopsy, whenever there is a biopsy, it has to have pathological examination, which is called histopathology. So it is sent for histopathology, and there are further tests. And if they find a lump, which say a patient comes for, my mother has something wrong with her breast, and she comes to us, and we send her for the test, and there comes a very small lump. If the lump, and it is such a small that clinical examination is clear, but there is a lump on the investigations found on radiological investigation, may it be ultrasonography, may it be mammography, then we would request for ultrasound guided fine needle aspiration cytology, which is FNAC.
Okay.
So I think biopsy should not, people think biopsy is a kind of, it's a death sentence. No, it is not.
The word.
Yes.
It's actually the word, you know, that when you hear somebody saying, I have to go for a biopsy,
It's like
all
death
of a sudden
sentence.
it's like alarm bells are ringing and everybody is just, you know, terrified.
And people start, their friends and everything, no, don't go for biopsy, it will turn into a cancer.
That's true.
Now here I would like to say cancer starts as a cancer, and the other diseases, they are other diseases. For example, if it is a common cold, it is common cold, and if it is flu, it is flu, and if it is cancer in the nose, it is cancer in the nose. If it is sinusitis, it is sinusitis.
But
May it be due to many causes. So they should not be scared when we ask them to have their biopsies done, because this is the biopsy which can clear them.
Of course.
Rid them of the fear. So they will go home, they can enjoy their life, and they can go home very light.
And their mind will be at peace.
Yes.
Not only theirs, but the surgeon as well, and the people who are treating, the doctors who are treating them as well.
And whole family.
Right, exactly. You would...
There's a, I don't know, there's a psyche that when normal people who are coming to you, even if they have a pain, something like that, a smaller thing, they would just ask, cancer to nahi? Like, it's like,
Yes.
yeah. And when it comes to biopsy and the real thing, they would just back off. So I think this is the awareness that we are giving, that when there are things that need to be cleared up, so at that time you have to take some important decisions.
Yeah.
And if biopsy is needed, they have to go ahead with it.
And there's
Because
no
early
point.
detection is answer.
Of course. I mean, and it's not as if a person can run away from biopsy and then they won't be needing further. I mean, what they're really doing is setting themselves up for
more stages
more
and
treatment, and more aggressive treatment, and for a disease to be progressing. Dr. Isma, tell us about patients that come to you, ladies, women who come to you with different issues. How do you counsel them? How do you get them to get proactive? Because one thing I found, there's a difference between women who are in the West and women, especially from our part of the world. We tend to give ourselves less priority. The house will get more priority, the children will get more priority, the husband will get more priority, but we're always on the back burners. Why?
One thing I've noted, that only those women who have family members suffering from breast cancer, say their mother, their sister, they do come over because they see the agony and they see all the things that they have been through. Those are the women who walk in and they come over for physical examination, because it's probably a religious thing, or they are shy. Nobody tries even to
social
check.
constraints.
Yes, they don't check themselves, because if there's something big, they feel the lump, then they will come to you. This is not a regular practice that they will check, and this is what Dr. Rakshanda is also saying, that we should make them aware about this thing if they do some physical examinations. And yes, I always make my female patients aware that they have to take care of themselves, because they are the ones who are taking care of so many people, and they just don't take care of themselves.
That's so true. They're overworked.
Yes.
Here I would like to add on her that she rightly said they should examine their breasts and they should look after themselves. If a woman occasionally practices her breast examination, she would detect a lump that of a size of a lemon or small walnut. And if she is examining her breast every month after the periods, she would detect that of a size of an almond. And if she undergoes mammography for the first time, then the smallest lump is detected as 1 centimeter. And if she has her screening again and again, then sub-centimeter, even less than a centimeter.
Right.
The earlier they come, the less is the treatment, and there will be no change in form and figure, and there are chances of cure, and they can continue with their life like a normal person.
Right. Okay, so we're going for a break right now. Don't change the channel. Stay with us. Welcome back to the program. Before we go on, let's have a look at this report.
How to recognize breast cancer symptoms. You will need a monthly self-exam, attention to breast changes, a medical exam, and annual mammogram starting at age 40. Step 1. Start performing a monthly self-exam as soon as your breasts are fully developed. Checking yourself regularly is important. You need to know what your breasts feel like normally so you can recognize any changes. Keep in mind that it's not uncommon for breasts to feel lumpy due to benign fibrocystic breast disease, cysts, scar tissue, infections, and other causes that have nothing to do with cancer. Step 2. Know what you're feeling for. A lump that feels different from your breast's normal lumpiness, like discovering a pebble in your oatmeal. Though many lumps are benign, anything that feels new or odd should be checked by your doctor. Even if you've recently had a clean mammogram, check for lumps in your armpits too. Step 3. Look for visible changes like dimpled, puckered, thickened, reddened, or scaly breast skin, or a flattening or indentation on the breast. All are potential breast cancer symptoms that should be evaluated. Step 4. Recognize the nipple changes that can indicate breast cancer. Pain, redness, scaliness, itching, skin thickening, the nipple turning inward, or discharge other than breast milk. Step 5. See your doctor about swelling in all or part of your breast or breast pain. Though swelling and soreness are usually no cause for concern, these symptoms can be signs of a rare but aggressive form of disease known as inflammatory breast cancer. Step 6. Have your doctor perform a breast examination at your yearly checkup and begin annual mammograms at age 40. If you have a family history of the disease, tell your doctor. They may suggest that you start having mammograms at an earlier age.
Okay, hope you found that informative. Now let's get back to our guests. As we approach, the end of this show, and it's been fantastic having you both here. We're talking about something that is so important, and all the statistics that have been given, all the things that we've been talking about. This needs to be pursued with the highest and utmost urgency. So let's start at home, because that's where the first step, takes place. Dr. Ismail, what would you like to see the role of not just the mother, but the female members of the family and grandmothers too? What should be done?
Okay, I want to share an interesting thing. One of my patients walked in and she would ask me to do examination for her. She told me that her mother was suffering from breast cancer and she would have her shirt stained with blood, but she would just hide it. And when they discovered it was like, because she used to hide it, put some cottons and things, and so that and when they get to know that, it was very late. And she came over and she said, I don't want to suffer the way my mother did. So and she got examination and luckily she was clear. Her lump was not cancerous. The most important thing is that we are not vocal about these things. The mothers, grandmothers, and they should make it a point that they should also examine themselves, because after 50, it's on a rise. And then the daughters, they can help them for these things, because when they are giving awareness about so many things, why not about this as well? The ladies, they can use the looking mirror to examine themselves. Not every day, but monthly they can do it. And they can come over to a physician. We can help them. We can examine them, and we can even tell them how they can do that. The other thing is, there's one thing else that the doctors in the community can also help in this regard. That the patients who are coming over, they should be referred to a surgeon. Not to a gynecologist.
Again,
because this is not a gynecologist thing. This, once a lump is felt, it's examined, they can go through, there are screening tests available. There are, we have BRCA1, there are genes BRCA2, and those can detect earlier about, there are screening tests that we do. The doctors should, they can always walk over to their physician, whoever is available, if they find a lump, right? And then they can get it examined. Then the doctor should, if they have it, they should refer to a surgeon.
Absolutely. Needing to be, proactive, needing to be assertive, and stop brushing things under the carpet and thinking that, no, this isn't, because denial is also a big factor. Dr. Shand, I wanted to ask you, we're talking about the role of women, mothers, grandmothers, aunts. How about sensitizing men? How do we do that? Because you did mention that there are quite a few men who say that, this is okay, it's nothing to worry about. So how do we address that factor?
I think if they are watching these programs through media, and our religion also says look after your women, and who is women when they are not married? It's mother and sister, and after it's wife and daughter, they should look after them, and if they complain about anything, they should take them to the doctor. And we were talking about screening, and I would like to add more, if this is being seen by somebody in the government, that we should make part of our LHV's training program They should go, because they go to very underprivileged areas.
They're the ones out there who are dealing with the
they
one-on-one.
are really with those women whom we can't, who don't have time to watch TVs or listen to
don't have
radios.
access, yes.
And even many of them don't have access, but they do have access to LHVs.
Right.
So this should be made part of the training program of LHVs, how to examine the breasts of these ladies. When they go there for their gynecological problems, they should also examine their breasts and teach them that you must examine your breast after you finish with your periods. And I would like to request more through this forum that if they put this in there is a chapter about female health in the probably class 7th or 8th textbooks, they should add this one too.
Definitely.
Every girl who
Absolutely.
turns 20 years of age should start examining her breast, and they make a diagram over there, diagrams. Through the diagrams, they can tell them. You know, in Islamabad, yes, we send our junior doctors to the villages. There are programs running in the PIMS and in the Nuri, but they are not enough. There are so many villages, there are so many underprivileged people.
Absolutely.
So if it is done through LHVs, through textbooks, maybe it is a bit adds to the information.
Absolutely.
And the boys, when they are young, they may read the text and may get the information about the disease.
It's also about, you know, adapting the mindset in a way that women can be able to talk about it with a family member, a female family member, of course, and not feel that this is something to be ashamed of or shy about. So this is also something, you know, what I feel is that we see so many dramas that are being produced and being watched by majority of the women. Or, I don't know about the men, but I know that many women watch them. Where do we see any constructive messages being portrayed? Mainly you see a scenario of a domestic household where there are different power struggles going on between different relationships. How's about them taking on a topic where, you know, you're able to identify a problem and put that through into society? Our media is also lacking this way, isn't it?
Yes, they should have many dramas, because many of our people, since we come across such people and they say, we don't know, we have never heard about it, because they don't care about health in this part of the world. So I think that is a very good idea if there are dramas, or at least, as she said, grandmothers.
Although even the word is being mentioned, that somebody will hear, okay, this is something, what is this? You see, that's the main thing. Dr. Smith, Dr. Shanda just said, you know, our part of the world, why don't we care about our health? Why don't we just wait for
we are
everything
starting it now.
Why do we wait for
beginning,
everything just to collapse on our heads and then we'll run helter-skelter to different doctors? Why can't we go to the dentist for that, you know, yearly checkup or the 6-monthly checkup, not lose our teeth or other things as well?
What I find, women are always rushing for all the, you know, the designer clothes and, you know, the things. They can go ahead for making clothes and jewelry and everything. And, you know, the most important thing is that you should look fresh, healthy and good, and then all the clothes are going to look good. So first of all, yourself. The health is important. You have to take a good diet. People, we never do exercise. You know, our nation is not into exercise.
It's just going to, I mean, if we're going to talk about exercise, it somehow seems, what I pick up on people is that the only exercise you can ever do is if you have to go to a gym. Why can we not do that at home?
Yes, it's not like that. Whatever is available, you know, you can walk. I even ask my patients, you can, what they are doing at home, that's fatigue. that we don't,
That
that
is
is not
true,
exercise. They say
that's
we have done
true.
a lot. I was walking around and I was working, but that's fatigue. That's nothing. And if you walk, you know, it will reduce the stress on you and make things very, you know, you're in a better place to do certain things if you are healthy. So they should, in our setup, why not walk? There are so many parks, or you know, even in our villages and everywhere, people can walk. They do walk around.
They do
That's
walk,
why they're better than us.
They're
in their
more
health.
healthier,
Yes,
absolutely. Well, we've come to the end of today's programme. It's been absolutely fantastic having you in the studios. Dr. Kshanda, thank you so much for taking out the time from your busy schedule. You as well, Dr. Uzma, thank you so much for being here. It's been a really, really important, informative programme, one that I really hope that many women who are watching today, men as well, it's going to work both ways, that they will understand that, you know, when they see a pink ribbon, what exactly this means. And, you know, the thing is that what we say again and again and again is life is a gift. It's a treasure. It's a blessing. So, you know, why not be thankful to the Almighty who has given us this life and live it the best way possible? So for that, you know, prevention is always better than cure. Please listen to all the tips that have been given in this program and stay happy and stay healthy. See you next week. Bye-bye.